of our series of talking about important people and what they do. And I am very proud to introduce Malcolm.nowlin. He is the Marketing Relations Director for Pittsburgh Business Group on Health. And I've come to know Malcolm for the past few years as I joined this organization, and Malcolm has always reached out to me. And his organization is for very big companies, and I'm kind of the little fish in the sea. And yet Malcolm has always been gracious. He even came to hear me speak, and the only other people that came that day were people I had to pay. So I was very appreciative of that, and he represents a very important organization in today's field, and it's a pleasure to have you here, Malcolm.
The pleasure is all mine. Thank you.
Yes, welcome, and thanks for taking the time to talk with us today. So tell us a little bit about your background and how you ended up working with Pittsburgh Business Group.
All right, wonderful. Well, first of all, I want to thank you, Jeff and Rachel, for inviting me. I truly appreciate it. I absolutely love Jeff and the organization.
Did you hear that, Rachel?
I feel the
same. I truly do, because you are you are offering and providing a great service. Who cares for the caregiver? Jeff does. And
you.
so I'm just honored to be here. So a little bit about my background. I am born and raised right here in Pittsburgh, Pennsylvania.
Yoo-hoo.
Yeah, go Pittsburgh Steelers.
Go Steelers.
I grew up on the north side, Jacksonia, Manchester, Federal Street area. I went to school at Martin Luther King Jr. Elementary School. I went to Allegheny Middle School. Also went to Rogers Middle School, and Carrick and Kappa for Creative and Performing Arts, where I studied vocal performance. And Tanglewood Music Institute in Lenox, Massachusetts, as well as Duquesne University. So a lot of who I am is Pittsburgh. You know, I stayed on the north side until I was about 12 years old. And, but I call that home because that's where I learned the good, the bad, and the ugly. Yeah, that's a little bit about me. And as far as you said, how do I get to where I'm today? Prior to working at PBGH, I was at Citizens Bank. I worked at Citizens Bank for 16 years. I managed several different locations at one time. But I knew there was more for me to do. I wasn't sure where I was going, but for a long time I said, there's something else I'm supposed to do. And I remember talking to my CEO, Jessica Brooks, and her husband. We were at this same event, and I was just sharing with them some things. And next thing I know, I get a call from Jessica a few days later, after we met at my daughter's school. I get a call saying, "Hey, we're thinking about this position at PBGH." And we talked for a little while on the phone. We met with each other, and she introduced me to some consultants. And I said, this is it. This is where I'm supposed to be. And so that's how this all started.
I love that.
Jessica's the president of PBGH.
She is the CEO and executive, well, she was CEO and president of PBGH. That's correct. Yep.
And she's an amazing person as well, because she just does, as the leader of the organization, she really is in the forefront in thinking.
Absolutely.
Of what needs to happen in healthcare, and in particular with companies.
Absolutely.
So what does Pittsburgh Business Group on Health do, especially for those who might not know?
Absolutely. So the Pittsburgh Business Group on Health is one of the nation's leading nonprofit organizations. focused on protecting the ability of employers to provide high quality, equitable, and affordable health care and benefits to create a healthier workforce. We provide a variety of comprehensive and insightful educational opportunities for employers, which I think is very key because there are a lot of employers who are looking for that education, looking for that support, looking for the tools that they need to help them be successful and to empower them. And so we're providing those tools for them with group purchasing as well, group purchasing programs. And we help them to mitigate waste. And we actually helped employers save nearly $25 million in prescription drugs savings and costs. So, excuse me, in prescription drug costs. That was a big.
No, no, that sounds especially important with all that's going on in the world right now, too.
Yeah.
So how has the pandemic affected companies and their employees from what you've seen there?
Yeah, so being the market relations director for PBGH, I work closely with all our members, our employer members, our allied members, and our associate members. And I made it a point to reach out to all of our members, our employer members in particular. So I found out how they're doing, how they're feeling, simply just to say, you know what, we're here for you. Think PBGH first. And so what I heard from calling them and spending time with them virtually, they were simply saying, you know what, our employees are mentally drained. Our employees they're being challenged by so much, not just the pandemic, but the social injustice, economic crisis, and now their kids are at home. They're like, what do we do? Right. And so absolutely. So there was so much for them to navigate. So those were the things that were on their mind. We had the Family First Act, and some of the employers like, okay, this doesn't even apply to us. So they wanted to connect with other employers, and we were able to do that. We were able to connect them with other employers so that they can collaborate, that they could work through things. We were able to put together cluster meetings for the employers so that they could talk these things out together, because again, they were all in the same boat. They wanted to know, how can we save on healthcare, and how can we accommodate our employees and their needs and meet them where they are?
Yeah, absolutely.
So mental health was a major issue for all employers.
Yeah, that's really important work. And it kind of segues into the next portion of as far as kind of switching gears to caregivers and the conversation of caregiving in the workplace. So at least 20% of the workforce are full-time caregivers. Yeah. And this group is stressed to the max, as is everyone, like you were just mentioning. And they have a history of increased absentee and tardiness, affecting their productivity. So what are companies doing about this problem, and what could be done to help it?
Yeah, this is definitely a growing and burdensome reality for all of us. And one PBGH believes must be faced by employers, government, and non-governmental agencies, along with the private sector. We believe technology can and will play a growing role in how caregiving is managed by employees. Many employees are considered the sandwich generation, with younger children at home, now learning remotely, as I said, and aging parents who might require some level of assistance. I'm in that boat as well. So the most important things companies can do now is to listen, show empathy, be transparent. When we say we're all in this together, let's show that we're all in this together. It has to go beyond lip service, and we really have to show, you know what, I care about where you are. I see how this is affecting you. We have to be able to be attentive to one another's. And so that's what we encourage employers to do, to be attentive, to listen, understand challenges they're facing, and the mental, social, and financial impact, because it's affecting people's pocket. And when it affects your pocket, it can do a lot to your health negatively. And so what we're finding is that companies are adopting new flex programs, shared jobs, continue to consider how telehealth services can augment access to care. Telehealth is blowing up. Companies are really utilizing telehealth to help their employees, and it's something that's great, because if what I should say is, employees, they might not want to leave the comfort of their home, especially during this pandemic. But if they can call somebody and then they can have a virtual visit, so employers are taking advantage of that.
Right, right.
I've done a lot of that myself, Malcolm. People have just reached out to want to talk about their stress levels and things like that. But your discussion on listening is just so important.
Yeah.
And I have found, in just not a lot of work in working with companies, that the bottom line is more important than the people. And I have tried to stress with them exactly what you're saying, because if the employee feels like there's a family-oriented company and they care about them, the odds are that they're going to be much more happier at work and be able to stay at work.
Right.
With they don't feel like that's coming from the company. The company's going to end up with a lot of turnover and things like that.
And you know, Jeff, it's not just listening, but it's actively listening,
Right.
showing that you listen, showing that you care. And for that caregiver who is constantly giving and constantly trying to help somebody else, they need to know, hey, my employer cares about me. My employer is empathetic and is showing in one way or another that they are with me. And when that happens, as you were saying, Jeff, it makes me feel more valued. It makes me feel more appreciated. As a matter of fact, it makes me want to fight with the company and really get in the trenches with you, because you show me that I matter and what I'm going through matters. And I think that when we get to that point where we're all in this together. Okay, let's be in this together. And there's so much that we can do. Sometimes, it's just a simple, how are you doing? Or I've noticed that you aren't as bubbly or lively than like you always, or like you have been in the past. Being able to say, I see you. I care. I think it all matters. It goes a long way.
Have you guys ever thought about like doing training with companies dealing with either active listening skills as well as possible dealing with stress management in the workplace?
I can't say about active listening, but yeah, we deal with things like as it relates to stress, because that has a lot to do with one's health, their mental state. So yeah, we definitely try to help with the mental state, with mental health, because whenever, for instance, when we look at 2020, you're either turning to someone else or you're turning to something that you shouldn't turn to, which is alcohol or drugs. And so we try to provide the necessary tools that employers and employees need so that they won't go back to those things. Because as you, I'm sure you all heard over and over again in the news, how people have gone back to turning to substance abuse and things like that. So we try to provide the education that these employers need, and also the resources so that it would help their companies as well as their employees.
There's also a tremendous increase in suicide.
Yes.
And because
Yes.
people, like you said, they're totally overwhelmed.
Right.
They don't have a outlet to be able to talk about any of this stuff.
Right.
And the suicidal rate has just skyrocketed.
You
And
know
it's
what, Jeff?
very sad.
I'm sorry, Jeff.
No, I just said it's very sad.
Yeah, I had a great friend I love dearly. You know, he was dealing with depression. Now, me, Jeff, I get up in the morning. I'm a morning person. This is me all day long. Now I get tired.
I can attest to that.
Now I get tired too. I get weary too. But I'm not in the corner somewhere like I'm going to be here all day. No, I'm able to come out of that. But some folks aren't able to come out of that. And some folks feel embarrassed to talk about it. So we
Right.
have to create an atmosphere,
Right.
a culture
Yes.
where folks can be free to say, you know what? I was in my room all day and I didn't want to come out. As a matter of fact, I was in the room for the last couple of days.
Right.
We need to be able to create a culture where people can be free to get help and to know, you know what? I can't truly say I understand what you're going through, but I can definitely be there for you, and I can definitely help you through this if you allow me to. So back to my friend, he, again, I wasn't able to understand because I don't battle with depression. But I was able to be empathetic, and I was able to be there for him and to love him for right where he was. And he knew he had a safe place with me, a safe place to land. And I did what I could for him to walk him through that. And that's all we really have to do. We have to be there. And we have to show that, you know what, this is a safe place. You can come to me.
Mhm.
Well, your compassion, Malcolm, both at what you do at work as well as who you are as a person, really, it's very obvious, and it's something to be commended because as we were talking before we started this video, 2020 has been a very tough year.
Yeah.
And you and myself as well, if you look at all the negatives, you could never get out of your house.
Absolutely.
But if you can
Absolutely.
if you learn to appreciate the things that you do have
Mm-hmm.
and function with those things as, well, this isn't as bad as, I thought it was,
Right.
because I still have my health, I have my family,
Right.
I have a job, or if I don't have a job, I can get a job because I know what my capabilities are. So we have to be able to emphasize what's good, what's positive in our life, and what's positive about ourselves.
Yeah.
And you do that tremendously, Malcolm.
Well, I appreciate that. I grew up, my mother was addicted to drugs. My father was addicted to drugs. And my mother was also addicted to alcohol, and my mom's friends and were addicted to drugs. I mean, as a child, I would walk in the house coming from school, and my house was like, the crack house, but only thing is they were shooting up heroin.
Oh my.
And so I remember coming home from school one time, and I couldn't even get into my house because my house was being raided by the police.
Oh.
And that was tough. That was, as a child, that was very, very difficult, extremely difficult. But I said, you know what? I want to be better. And don't get me wrong, I did my stuff too. I did my share of stuff, but I always knew I wanted to be better. I didn't, this is not the life for me. So it made me stronger. It made me more compassionate. It made me more sensitive to people and things around me. And it also helped me to, going back to your point, Jeff, be more grateful. So when I look at where I come from, I look at everything that we're dealing with 2020, the pandemic, and social injustice, economic crisis. I think about all the things that I've been through, and I'm still here, right? And look, Rachel and I, we're in Hawaii right now. You know?
You have to rub it in, huh?
But seriously, I shared about my family. It all goes back to perspective.
Right.
It all goes back to, okay, how am I going to use this situation to make me better? How am I going to, and not only make me better, but help somebody else be better? Absolutely. And that's the name of the game. You know, again, it goes back to that saying, we're all in this together. We all have to be in this together, no matter the color of our skin, no matter our economic status. We all have to be in this together. And we have to remember, gratefulness is a great place to be, simply because it changes your mood, changes your attitude, and it causes you to stop thinking, and causes me to stop thinking about what I don't have as opposed to what I do have.
Malcolm for president.
Hey.
I
don't know if I want that.
I love everything that you said, and I also feel like I'm happy to see that the stigma on mental health is being discussed more and being discussed more in the workplace. I recently heard on a podcast that one day mental health and depression and things will be considered like arthritis, where you're not afraid to tell someone that you have it. So you're employed, so you can, learn how to function in the world with whatever you got going on.
Absolutely.
We all have something, so.
All of us, we all do something.
And I love you sharing your truth. Thank you for being, open. It's even more empowering to hear a story like that. So thanks for sharing.
It's my pleasure. It's all going to be in the book soon, coming to you.
Yeah, I'm ready for it.
So I'd be the first to buy a book. For
real, me too.
All right.
So where can people connect with you? Where can people connect with Pittsburgh Business Health? How do people find you?
Yeah, so you can connect with me directly. You can call me at 412-956-9144. Again, that's 412-956-9144. You can email me at Malcolm.nowlin at pbghpa.org. That's MALCOLM.NOWLIN at pbghpa.org. You can also check me out on LinkedIn. I have Monday Moments with Malcolm, so you can check that out. Monday Moments.
You do? I didn't know that.
Yeah, on LinkedIn, have Monday Moments with Malcolm, where we're dealing with what the things that employers are challenged with. So very briefly, we deal with what the employers are challenged with and how PBGH is helping.
Awesome.
Oh, that's tremendous.
Great.
We'll put that on when we put up the video.
Yeah, we'll put the links below.
All of your links.
I appreciate that. Thank you so much.
Yeah.
Great. Well, thank you so much for joining us today at the beach.
Hey, yeah.
Really appreciate your time.
We're overdressed.
We are a little overdressed for the beach.
If I'd have known you were at the beach, I would have worn my bathing suit.
Next time.
Exactly.
Thank you so much for your time and wisdom and sharing. Is there anything else that either of you would like to add before we close up shop here?
Again, I was just going to say thank you so much. I truly appreciate the work that you're doing, Rachel, and the work you're doing, Jeff. I'm glad to be connected with you. So thank you, and thanks again for having me.
Well, you're just, I told Rachel that, because she didn't know who, she knows a lot of my contacts, and you were my secret weapon, Malcolm.
I appreciate that.
He's just an incredible human being.
Absolutely.
And I mean, it's so heartfelt, the things that you've said and the things I know about you, that I just think you're just a great guy. And I'm glad that we're going to be able to put this video up about you and Pittsburgh Business Group on Health.
Well, I truly appreciate that. Thank you so much. That means the world to me. So thank you. Thank you.
My
Really nice
pleasure.
to connect with you. Thank you for your time.
Wish you the best.
Next time, Rachel, you and I we can do a jingle. We can do it.
I look forward to that. I bet you're a great singer. I can already tell you got soul, real soul.
You don't want me singing, I can tell you that.
All right. Happy
All
New
right,
Year.
guys.
Happy New Year.
Wish you the best.
Thank you. Bye.